Why do you get breast cancer? Even though breast cancer is the second most common cancer in women, after skin cancer, they are living more nowadays, due to improvements in detection, treatment, and awareness. It is well known, your genes, hormones, and lifestyle behaviors affect your chances of getting breast cancer. Eating healthy and exercising prevents weight gain, and thus, reduce your disease risk. There are simple habits, from drinking alcohol to working late nights, that can lead to a breast cancer-positive mammogram. In addition, there are many surprising habits that may be harming your breast health. Estrogen in birth control pills is effective in stopping unwanted pregnancies, but it can become a cause for concern when it comes to breast cells. High doses of the hormone in the blood can increase a woman's breast cancer risk by overstimulating breast cells. A 2014 study published in the journal Cancer Research found recent use of oral contraceptives among women ages 20 to 49 was associated with an increased breast cancer risk, depending on the formulation. High-dose estrogen, that is more 50 micrograms in birth control pills, was linked to a higher risk of breast cancer in younger women, but using these pills with a low dose of estrogen, 20 micrograms, was not. The choice of whether to breastfeed or not is a personal one, but women who decide not to breastfeed may face a higher risk of breast cancer. In a 2002 study published in the journal Lancet, researchers analyzed data from 47 previous studies, to show breastfeeding slightly lowers a woman's risk of breast cancer. The longer a woman breastfed for 12 months, the lower her risk was compared to those who never or briefly breastfed less than 10 months. Their children. A more recent study published in the Journal of the National Cancer Institute provides further evidence breastfeeding can lower breast cancer risk as well as a woman's prognosis if she's diagnosed. Breastfeeding women had a 30% lower risk of recurring breast cancer and a 28% reduced risk of dying from their breast cancer. The higher your skirt size gets over the years, the higher your risk for postmenopausal breast cancer. A study published in the journal BMJ Open found women who went up a skirt size every decade between their 20s and 60s, increased their risk by 33% compared to the 77% risk for those who increased 2 sizes per decade. Skirt size provides a window of the wearer TMS abdominal fat, suggesting a link between weight gain and breast cancer risk. Although no one knows how fat contributes to this correlation, researchers believe it are TMS because body fat around the waist is metabolically more active than other fat tissue in the body. The amount of alcohol consumed increases the risk of developing breast cancer, especially those who have 2 to 5 drinks daily, according to the American Cancer Society. A 2011 study published in the Journal of the American Medical revealed having 5 to 10 grams of alcohol a day, or 3 to 6 glasses of wine a week, raised the risk of breast cancer by 15%. With each 10-gram increase in alcohol use per day, the risk climbed 10%. A late-night snack can satisfy your cravings but become dangerous to your breast health. A recent study published in the journal Cancer Epidemiology, Biomarkers and Prevention found eating meals at set times and dining early in the evening can reduce a woman's risk of developing breast cancer due to glucose. When you eat, the body breaks down the sugars and starches into glucose, entering the bloodstream. The glucose is then directed by insulin to your cells, so it can be used for energy. A lack of insulin can cause blood sugar levels to rise and stay high, which is linked to an increased risk of breast cancer. Working the night shift is known to disrupt the body's circadian clock, leaving you physically exhausted and sleep deprived, and it can also raise your risk of breast cancer. A 2012 study published in the journal Occupational and Environmental Medicine found women who work night shifts were up to 4 times more likely to develop breast cancer than those who did not work nights. The effect was cumulative as women who worked at least 3 night shifts a week for 6 years had twice the risk as those who worked 1 to 2 night shifts per week. The researchers speculated the disruptions to the body at TMS internal clock led to changes in hormone levels. Since these employees work at night and sleep during the day, this alters the circadian rhythm and the levels of melatonin, the hormone responsible for regulating sleep and wake cycles. Lower levels of melatonin are more seen in breast cancer patients than women without the disease. Thank you.